Every day we come to work, we try to provide superior musculoskeletal care for the people of the 4 states area. We do that through evidence-based medicine, through best practice standards, and really through shared decision making. It's having that conversation with the patient. It's great to practice medicine with statistics and with epidemiology, but every time you have a one-on-one encounter with a patient, it's really what can I do best to treat this individual that's sitting right in front of me? Or how can I help them achieve the goals that they want to achieve? For instance, before coming here today, I just came from clinic and I saw a gentleman that was involved in a very severe accident back in September where he could have lost limbs and would have been unable to get back to either any of the occupational or recreational activities that he loved to do. And so I guess September to now is about 8 months later. He's back playing golf, he's back at work, he has all of his digits and hands and feet and arms and limbs. And it was because of the care we could provide here at Freeman, and it was because of the great things that we can do in the field of orthopedic surgery that allowed him to go from probably one of the worst days of his life to almost at a point where he's back to normal. You don't have to live in pain. You don't have to live with dysfunction. If there are musculoskeletal issues that are bothering you, it's always great to seek an opinion of a professional. And certainly my advanced training is in shoulder and elbow surgery. The vast majority of my practice has to deal with the upper extremity. And so if they have upper extremity issues or problems that they want to have a conversation about, they want to find more information about, they really feel as though they need treatment or just guidance on what the best treatment might be for them, we can have that conversation.
What drew you to your specialty?
I would say I was a young boy, and I think when you are young, you have this inflated sense of self, and you want to be a professional athlete, president of the United States, astronaut, whatever it is. And when all of those dreams went by the wayside and I started to look practically at the types of jobs that I could have when I got older, and I realized that there were certain subspecialties of medicine that took care of athletes or getting people back to the activities that they loved, I stumbled upon orthopedic surgery. I think I made the decision when I was 14. It was probably a little bit early, but that was the track that I wanted to go down. Things worked out through high school, college, and medical school, and then getting into residency, where I think found that I really did love the subspecialty, and it gave me an ability not only to treat athletes, but to treat people of all walks of life and help them to get back to the activities that they love doing. When looking for a job after coming out of residency, my wife was from the Midwest, I was from the Southeast, and so we looked at a large number of jobs in over a large area that involved multiple states. Joplin was one of the places that I stumbled upon in my job search, and then when I came out here to visit, I really fell in love with the community. I fell in love with the hospital, the administration, and all of the partners in the group, and felt like it was a collegial environment that I could work in and thrive in, and that Joplin is a community that we could raise our family in and really get involved in a lot of the great things that there are to do here in Joplin. My fellowship was shoulder and elbow surgery, mainly focused on the shoulder. I would say the lion's share of my practice is in shoulder surgery. That would include, shoulder replacement operations, fracture reconstructions, open instability operations, arthroscopic instability operations, arthroscopic rotator cuff repairs and rotator cuff reconstructions for irreparable rotator cuff tears, arthroscopic treatment of labral issues, biceps tendon issues. We treat frozen shoulder and other conditions around the shoulder. And certainly the year that I had in training for fellowship prepared me to execute those operations at a higher proficiency than someone that might not have had that training. But also being in practice, I guess now for 10 years here in Joplin, we have a vast experience in treating all conditions of the shoulder and elbow. Exactech GPS is a navigational guidance that we use during shoulder replacement surgery. Shoulder replacement surgery is a great operation for relieving pain and dysfunction due to end-stage shoulder arthritis, due to conditions such as rotator cuff arthropathy, post-traumatic deformities, post-traumatic arthritis of the shoulder that will allow patients to achieve relatively pain-free and functional range of motion. With shoulder replacement surgery, the hardest portion of the operation is to implant the glenoid components, or the socket of the ball and socket of the shoulder joint. What the Exactech GPS does is it utilizes preoperative imaging, a CT scan, a preoperative planning software, and so the CT gets reformatted into a three-dimensional image and get placed into a computer program where we can utilize it like a CAD design software, like an architect would, to look at the exact anatomy of the scapula and to plan what type and size and location that the socket component is going to be best placed. One of the largest problems with the shoulder replacement surgery is it's very difficult to get the socket component in the absolute correct place. And with the Exactech GPS, you can get within about 1 to 2 millimeters and about 1 to 2 degrees of version and inclination. So you can improve your accuracy considerably, which provides the patient with a better replacement in hopes of giving them more anatomic function and a better long-term survivorship.